today we are going to see about the case study on the particular bone. So the patient is having an angina, chest pain, and the patient has been posted for a CABG, coronary artery bypass grafting, because the patient have a block in the heart. They have to visualize the heart. So they have to break certain bones to visualize the heart and do a surgery. So in this case, what bone will be helpful for visualizing the heart and how to break the bone? First of all, what is the bone is actually and what are the parts of bone will be explained by us.
My name is Lavina. She is Satya. I am first year cardiopulmonary perfusion care technology, SNS College of Allied Health Science. I explained sternum.
Okay, the bone is sternum.
The bone is sternum. Sternum is elongated flat bone median on anterior chest wall. It presents three parts: manubrium, body, and xiphoid.
Okay, it has three parts: manubrium, body, and the xiphoid process. Okay.
It is obliquely placed on anterior chest wall. It upwards and forwards, concave posteriorly, thicker below, thinner below.
Okay. The manubrium is much thicker comparing to the body of sternum.
I explained manubrium. Manubrium is a quadratic segment of the anterior chest wall. It presents posterior and anterior and posterior, two lateral border, superior border and the inferior border. Posterior is smooth and convex.
Anterior will be somewhat concave. You can see it is somewhat on the projecting surface and it is almost on the inner surface. So the anterior is somewhat concave. Okay.
Superior border is presenting notch on median plane. It's called jugular notch. Either side present on the notch is called the clavicular notch.
Okay. Here you can see this clavicle has been attached with the manubrium. So this is called as clavicular joint. Clavicle has been attached with the manubrium. Okay.
Inferior border. It's a narrow or good small oval faced upper end of the body of the sternum. It's called manubrium sternum joint and sternum angle. Sternum angle is also called Lucy's angle.
Okay. So sternal angle is present here. That is the end of the manubrium and the body of sternum is attached here. So sternal angle have so many clinical importance why it is present and why it is mentioned everywhere is. And the sternal angle where it is also called as an angle of Lewis. Okay. So end of the first rib attachment you can have your sternal angle.
It is junction between the manubrium sternum and body of the sternum is called sternal angle. Female sternal angle is 165 degree and male sternal angle is 163.4 degree. Then lateral border cup shaped depression. It's cup shaped depression with the articulate with the first costal cartilage.
Okay.
Upper end of the body is articulated with the second costal cartilage.
Okay. So the upper end of the body means this one. Okay. Below the sternal angle, this area is called as upper end of the body, where the body starts here, and this is the lower end of the manubrium, where it have only one rib attachment and one articulation, which is called as first rib articulation on the lateral surface of the manubrium. Okay.
It's a jugular notch. Its attachment called interclavicular ligament. Then posterior is called pectoralgus. Then sternocleidomastoid.
Okay. Sternocleidomastoid actually it is attached with the clavicle, although also with the manubrium surface of the body.
Then posterior surface is called sternothoraid and sternohyoid. Then clavicular notch is called capsular ligament and sternoclavicular notch.
Okay. So it's all about a manubrium. Next we are going to see about the body of the sternum.
Body of the sternum, it is longer and narrow the body of the sternum.
Okay, it is a longer and narrower part of the sternum. It has two surfaces. What are the two surfaces?
Anterior and posterior.
Yes,
surfaces.
anterior surface and the posterior surface. What are the two borders?
Two lateral borders.
Okay.
And two ends, upper end and lower end.
Okay, it is also having upper end which is attached with the manubrium, and it is also having a lower end which is attached with the Ziphi process.
Anterior surface marked as transverse body of the sternum. Four segmental.
It has four different segments. How the segments is produced is based on the embryological development. Okay. What is the line present here is called as, which is called as transverse ridges.
Two lateral borders.
Okay, two lateral borders have an articulation with the ribs. Okay, so you can see these are the lateral surface of the body of the sternum. It articulates with the various ribs. So from which rib is it is attaching is from the second rib. Mammalian has a first rib, and from second rib it is attached with the seventh rib. Seventh rib it is an articulation. So these areas is called as costal surface of the ribs. So it is attached with the body of sternum. It is called as costal surface, which is called as costal ligament. Okay.
Seventh costal cartilage articulation with xiphisternal joint.
Okay, it is attached with the xiphisternal joint. Xiphisternal joint means it is an continuation of the xiphoid process.
Upper end and lower end. Lower end articulates with
Xiphoid process.
Upper end articulates with body of the sternum.
Mandible. It is attached with the mandible. Okay. What is the exact shape of this is?
It is slightly concave.
Okay.
Posteriorly convex.
Convex, and it looks like a sword. It is the appearance of the sword in the body, and it is one of our strongest bone. As like I say about a case study, the patient have to do an CABG, coronary artery bypass grafting. They have to open the sternum. Okay, so they will do an incision directly on the sternum. They should break the sternum together through a sternal divider, and you can able to visualize the heart. So the function of the sternum is it protecting your body, it protecting the integrity of the ribs, it protecting the internal organs. And the sternal angle have so many clinical importance. Why? Because the sternal angle having an major articulation areas where your heart's ascending aorta, arch of aorta and the descending aorta has been ending off, and you have a numerous value because you are calculating the ribs count with the help of the sternal angle for placement of the leads in the ECG. This is also an important factor for calculating the counting of the intercostal space. Okay, for doing any intraoperative procedure.